Hi, everyone, and thanks for joining today's briefing during what is an incredibly busy and challenging time. I hope all of you and your families are staying safe and healthy, and we're just so thrilled to have you jump on with us today. The briefing addresses a subject ripped from the headlines but rarely called out explicitly: public benefit programs on which millions of us rely, ranging from unemployment insurance to IRS relief checks to the Supplemental Nutrition Assistance Program, or SNAP, are hopelessly out of date and often dysfunctional. Archaic computer systems, rules, procedures that have no place in 21st century America have undermined these programs' capacity to achieve their core goal, with grim consequences that affect more of us now than ever before. And for reasons our panelists are going to discuss, these problems could get worse, not better, unless Congress takes action now as part of the next COVID-19 relief packages. Next slide. We could not have a better panel to address this issue today. Stan Dorn, Director of the National Center for Coverage Innovation at Families USA, is one of the country's leading experts on eligibility and enrollment into health coverage, but his work has also touched on other benefit programs as well. Before Families, for example, he worked as a senior fellow at the Urban Institute, including leading a major research project for HHS, examining strategies for modernizing and integrating both health and human services programs. And Michelle Evermore, Senior Policy Analyst at the National Employment Law Project, is joining us today, and she is one of the country's leading experts on unemployment insurance. If her name sounds familiar, it's because you've probably read it in story after recent story in the New York Times, the Washington Post, and other leading outlets. Before coming to NELP, she worked in the union movement, the Obama administration's Labor Department, and spent a decade serving on Capitol Hill. And finally, before we launch into the briefing formally, I want to describe how this webinar briefing is going to proceed. We are going to leave a lot of time for questions after Stan and Michelle's remarks. Please send us your questions and comments via the chat window, and we will get to as many of them as possible after their presentations are complete. Both the slides you're about to see and a recording of this webinar briefing will be available on Families USA's website next week. So without further ado, here's Stan Dorn.
Thank you so much, Lisa, and it's really a pleasure to be with so many of you today. Very exciting. It's a busy time, and we're very grateful to you folks for joining us. We're going to talk about three things today and then take your questions. First, what has gone wrong? Why are so many public benefit programs flailing at precisely the time when we need them more than ever? Second, we're going to take a look, and when I say we, I mean Michelle is going to share with you information about the unemployment insurance program, in some ways serving as a poster child for how the programs that we depend on have not been coming through for us in the way that they should. And then finally, we'll talk about some ways that Congress in the next COVID-19 legislation can step forward and provide repairs that help these programs be much more functional, efficient, and effective during these tough times. Next slide, please. So the dysfunction of public benefit programs is in the headlines and has been for months. Some of these may be familiar to you, telling a grim tale about children having their needs for nutrition assistance delayed for months because it takes a lot of time to get a SNAP benefit up to take the place of school nutrition programs that have now closed down, unemployment insurance programs where websites were dysfunctional to begin with, rely on computer code dating back to the late 1950s and early 1960s, so there have been gigantic delays and wrongful denials, IRS backlogged, struggling to get out checks, and all kinds of serious problems with the unemployment insurance system that we'll be hearing about more later. It's been a real disaster in many ways. It's extraordinary that our public benefit programs have come through as much as they have, but the problems have come to the fore, spotlighted by the pandemic and its resulting economic crisis. Next slide, please. This matters. It matters a lot. Even before the pandemic hit, more than half of U.S. residents relied on one of 5 categories of public benefit programs, either publicly funded health care, Medicare, Medicaid, VA health, etc., Social Security, the Supplemental Nutrition Assistance Program, or SNAP, the program formerly known as food stamps, earned income tax credits for low-wage workers, and federal grants and loans to help people afford post-secondary school education. So while times were good, more than half of U.S. residents relied on these programs. Now times are not so good anymore for a lot of us. Once the pandemic hit and the resulting economic crash, millions more people turned to public benefit programs for help. So the unemployment insurance program, there were 2 million applicants during January through March. Now there are 36 million UI claimants as of early July. That's an 18-fold increase. More than one out of every five U.S. workers is receiving unemployment insurance or has applied for unemployment insurance. The SNAP program has grown in ways that we've never seen before. Over a few short months, caseloads rose by 17%. That's literally 3 times the size of any previous increase in caseload that we've seen over a comparable period. More than 6 million people were added to the program, and millions more are slated to be added as the program continues to implement that program for children that I talked about, the so-called PEBT program, where SNAP steps forward and provides nutrition assistance to children who can no longer get it at school because their school is closed. And then, of course, there's the famous $1,200 stimulus checks that the IRS has been sending out to 199 million people, 159 million people. My eyes are aging and my screen is shrunken, so I apologize if I read some of these numbers wrong. And there's about 12 million people eligible who may not be receiving benefits. So the bottom line is, now that we are struggling, now that more of us are struggling, more of us are turning to public benefit programs to help us make it through. Next slide, please. Now, that's not how it should work. The project that we're engaged in, that we're starting right now in terms of our public release of information, is a project that looks at how we can bring 21st century principles into eligibility and operations, eligibility, enrollment and renewal for public programs, the kinds of programs that we've been talking about. And there are 2 big developments in the 21st century that, in our view, ought to inform the way we approach eligibility, enrollment, and renewal in public benefit programs. One is information technology, computers, the kinds of computers that you are using right now to look at this presentation. We have amazing IT that we didn't have before, and we also have data. I mean, like it or not, the government has access to a lot of information about us, and often with benefit programs, they're in the position of essentially saying to a consumer, we want you to give us, the government agency, information that we already can access ourselves. But if you don't provide it, we're not going to give you the benefit, even though we really ought to know, we can know and we should know and that you qualify. So that's, and that brings us to the second big development with 21st century eligibility, which is behavioral science. So there's been a behavioral economics revolution that I'm sure most of you have heard about in the book Nudge and Freakonomics podcasts and so forth, which says, in the words of one Nobel-winning economist, that people are systematically irrational. We're not rational utility maximizers as we were all taught in Economics 101. We are irrational in regular, systemic, and predictable ways. So one of those irrationalities is an aversion to hassle, an aversion to form completion, a desire for procrastination, or put simply, tiny procedural requirements have huge impacts on participation in programs for which people qualify. And this isn't just relevant to public benefit programs. In fact, its most famous application comes in the context of private retirement savings accounts. If you go to work for a company that offers a 401k, maybe with an employer match, and they say to you, hi new employee, fill out this simple form and we will establish a retirement savings account for you, there's a 33% chance that you will be participating in that program 6 months after you start work. At a company that flips the switch and says, we're going to enroll you in our 401k account unless you fill out this simple form that opts out of coverage, 90% participate. In other words, for 50% of the workforce, quick participation in retirement savings accounts depends on whether you have to fill out a small form opting in or fill out a small form opting out. That's a huge impact on behavior that results from a small procedural requirement. Another example with an even smaller procedural requirement involves Louisiana's Expresslane Eligibility program, and that turns on a checkbox. So let me explain. Expresslane eligibility is an option that was made available to states beginning in 2009, and Louisiana did it really, really well. The idea is if a program like SNAP has already found that you are poor, why force the Medicaid program to redetermine your eligibility? Why not simply say, SNAP has found you're poor, that's good enough for Medicaid, we'll give you Medicaid. Now, it's true, of course, that the technical eligibility rules differ between the two programs. Households are defined a little differently. There's different income disregards that are used to move people from gross income to net income. But the upshot is almost all children who are eligible for and receiving SNAP are eligible for Medicaid. So the Expresslane eligibility option let a state say, why should we go through this ridiculousness? If you get SNAP, that's good enough. You get Medicaid. Louisiana did an amazing job there. There's a requirement for affirmative consent to enrollment before Medicaid coverage begins. And Louisiana dealt with it by sending people Medicaid cards and saying, hey, congratulations, your child is eligible for Medicaid. You can show you want Medicaid by using that card to access health care for your child. They covered 20,000 children, I forget, 20,000 children within a matter of days implementing this. More than 80% of the children who enrolled used services, almost the same percentage as children who enrolled through other means. But after a while, there was an IT problem at the Louisiana Medicaid program, and they couldn't do automatic enrollment anymore via using your Medicaid card to access care. They had to put a simple little checkbox on the SNAP form. So, and it was bold and big and plain English, as good as you could possibly ask it to be. And the requirement to check that box cut enrollment into Medicaid from SNAP by more than 60%, just checking a box. So, and I could go on and on and on with examples from the behavioral economics literature that would stun and amaze you. And if you want to hear more, ask about it in the Q&A. But the bottom line is, just the more you ask people to do, the less people will wind up enrolling, even if they're eligible, even if they want that benefit and desperately need it. So those are the two big developments in the 21st century. With that, in thinking about how we modernize public benefit programs, there's three goals for three different constituencies. For consumers, easy enrollment, less paperwork, smoother process, fewer burdens in a time when people are overwhelmed. But really important, no denials, or as few denials as you can possibly bring, driven by red tape. We don't want people who are eligible for the benefit to be denied the benefit because they haven't checked a box or filled out a form. For state agencies, operational efficiencies. If you can determine eligibility by exchanging electrons rather than using manual procedures, that can save you a lot of money. So Louisiana's Expresslane eligibility, for example, wound up saving them more than $1 million a year of renewals, because when a child came up for renewal, the first thing they could do was ping the SNAP agency. If that child was receiving SNAP, they knew the child qualified for Medicaid, and that child would be renewed. Similar things saved South Carolina as well, more than $1 million. So there's operational efficiencies that come along with streamlined enrollment for consumers. And there's also more accurate eligibility outcomes. If you want, and in this context, it's very important to note, it is an erroneous outcome if an eligible person is denied benefits because they did not comply with procedural requirements. That's an outcome, you're denied the benefit, and it's erroneous. You were eligible. And so if we can reduce those numbers of procedural, the incorrect procedural terminations or denials, that means a more accurate system. And also, if we can link into sources of data that demonstrate ineligibility in a way that the agency itself wouldn't be able to detect otherwise, that can result in stopping the provision of aid to people who are eligible. So more data, a more modern system can potentially result in three things: better enrollment for consumers, more efficient operations for the state, and more accurate eligibility determinations. So how do you do this? Well, one key feature of 21st century eligibility, and all of these things have been implemented to some degree in the Medicaid program. It's moving down the road. It's got farther to go, but it's made really very impressive progress since 2010. So one piece is data-based grants of eligibility. The idea is if a data match can show that you are eligible, that should be enough. And so that means you need to structure your eligibility criteria to fit available data. Expresslane eligibility that I talked about is one example where, by definition, if you receive SNAP, you're eligible for Medicaid. So you defined your eligibility criterion such that a data match is enough, and you can enroll people based on that. Another example is Medicare Part D, low-income subsidies, which went into effect under the George W. Bush administration. In less than 6 months, their total take-up rate was above 70%, which was just extraordinary. And the reason they were able to do it is they defined eligibility based on data matches, and they conducted the data matches. So if you received Medicaid the previous year, or you received supplemental security income, need-based cash payments the previous year, and that was shown by a transfer of electrons from the Medicaid database or the SSI database to the Medicare database, you automatically qualified for low-income subsidies. And that's how most people got that benefit, and you were automatically enrolled into a plan if you didn't pick one. That it was just now, to this day, that program suffers with getting people enrolled who don't have that data-driven eligibility. But that use of data and the definition of eligibility to fit the available data has just done amazing things in places where we've been able to apply it. A second feature is a proactive public agency approach. That is, instead of the public agency passively sitting back and waiting for the consumer to take care of business, the public agency aggressively goes forward and takes care of business. So if the agency can find, based on data available to it, that that person is eligible, they provide eligibility without saying, nope, until you've crossed your T's and dotted your I's, consumer, we're not going to give you the benefit even though we know you're eligible, or could know you were eligible if we did the work required. Proactivity also means things like reaching out to consumers at renewal. If you can't qualify them based on data matches and they haven't responded to a notice, instead of just saying, that's it, you didn't respond, you're off the program, making phone calls, several phone calls to reach out to that person, texts, try to reach them, give them a chance to provide information in the middle of lives that are often busy and overwhelmed, and don't cut people off before giving them a chance. The third piece is really important, which is context-based defaults. Often the default is, well, if the consumer doesn't reply, then, well, they're ineligible and we're going to terminate them. Well, that depends. If you have data that shows the person continues to be eligible, they should be renewed by default. In other words, when it comes time for renewal, you send them a notice, you, the agency, you send the consumer a notice saying, please provide information, it's renewal time. But the question is, what's the default if the consumer doesn't respond? Traditional public benefit programs say, well, you didn't respond, you lose your benefits. A more modernized approach says we look at the data, we look at the context. So in Medicaid, for example, since the ACA passed, it's been a legal requirement that state Medicaid agencies need to look at available data at renewal, and if reliable sources of data show continued eligibility, send the person a notice, tell them they're eligible, tell them they're legally obliged to inform you, the state, of changed circumstances. But if you don't hear back from the consumer, you continue providing the benefit because the data shows that eligibility is highly likely. So that kind of change the default based on the data, based on the context, is a key feature of a modern eligibility program. Now, often we think of modernization just in the context of the consumer-facing website and giving the consumer the ability to apply online, manage their case online, provide information online. All of that is fantastic. And all of that is challenging. And as we'll hear from Michelle, UI programs have not quite come up to the mark in every single state in the country in operating just that basic function. But what we're talking about goes way beyond just a consumer-facing functional website. It's about the guts of the program. What are the rules for determining eligibility? What are the IT methods that you use to get the necessary information? What are the business processes you put in place to make sure that people get the benefits when they're eligible and only when they're eligible? So that's a lot of stuff, and all of that is critically important for high-functioning, modernized benefit programs on which so many of us depend. Next slide, please. So what are the barriers? Why have we seen these headlines about systems crashing and people not getting their benefits and people not even hearing whether they're getting it? People have, and you all have read the stories about people camping out overnight in front of unemployment insurance offices, waiting in line for hours to see whether they get benefits. Why? Why is this happening? Well, one key barrier is archaic information technology, that computer systems are old, that the software is old, the hardware is old, and we've seen this all across government and federal government and the state government as well. And this means it's harder to adequately serve your clients because it's clunky, it takes more time to process things, and it also, and this has been so important in the COVID crisis, it means changing the rules is a terrible, scary, costly, dangerous, risky process. You may have to actually go into the hardware to change an eligibility rule in a lot of state programs. And so that means that when there's a new benefit that comes along or expanded eligibility, it becomes triply hard to get that out to the people who need it. So archaic information technology is one really serious barrier. A second barrier is business processes, outdated or conflict-ridden business processes. So the outdated business processes involve designing a set of rules and procedures that ignores those insights of modern behavioral science that I mentioned. So I'll give you an example. And this is not a partisan matter. I just heard from an advocate in a very progressive, democratically controlled state where the Medicaid agency was saying, well, yeah, we know we could do these data matches and all that, but honestly, we just send notices to people, and if they don't reply, that means they don't want the benefit or they know they're ineligible. So why should we lift a finger to help them? So part of it may be a refusal to see what we've learned in modern behavioral science, but to borrow and contort the famous saying, what you see depends on where you sit. What you are willing to see can depend on where you sit. So another big factor is financial conflicts of interest, where the agencies administering these programs have adverse financial consequences if they give benefits for people who qualify. So now that state budgets are hitting the fan, and the fan is about to dig deeper unless Congress steps forward and helps, there is more pressure than ever before on state agencies to keep caseload costs low. And if that means you have to put stumbling blocks before people who are applying for benefits, well, that's what it takes. If it means you ignore Freakonomics and nudge, well, that's what you got to do. There are other pressures as well. So often federal reviews of agency determinations are one-sided. The review structure puts a big thumb on the scales against the consumer. So if you don't dot your I's and cross your T's in granting eligibility, you get a sanction maybe, you get called out in public for errors, but if you wrongly deny benefits to people, no problem at all. No sanction, no error rate, no public embarrassment. So the incentive is, when in doubt, make people do without. That's not a good incentive if you care about people getting the benefits that they need. So to fix business processes, we have to modernize them, and then we also have to deal with these conflicts of interest. A third fundamental barrier is obsolete methods of policy rollout. So here's how it works with most federalized programs. So Congress passes a law, hooray, we're a party. Then the federal agency promulgates regulations, issues guidance. They do that in English, not in computer code, in English and words. Then the state program has to promulgate regulations or issue guidance, again, in English and words, not in computer code. Then only after that is done, typically, does the state reach out to its IT staff or IT contractors and say, okay, time to reprogram the computer, time to do new codes. What are we going to do? You got to test it. You got to work it. There's problems. You try to fix it. Then the state, in a lot of programs, most programs now use private contractors and consultants to do a lot of the work. You have to reach out to them. You may have to change their contracts, change order, give them instructions, and then they have to make the decision, and they have to implement it. A complicated, multi-stage process. And at every stage, there's delays, there's obstacles, there's often turf battles, there's often errors that creep in. And that's a real problem when it comes to making quick, massive changes in these big, complicated programs. The fourth issue that I'll mention is workforce. And there's several dimensions of workforce issues. One involves limitations on people working remotely, which is an important issue in a time when, for a lot of state benefit workers and federal workers, to go into the office is literally to put their lives at risk. And so agencies, for cultural reasons, have often been slow to implement remote work options. I mean, the IRS, for example, did an experiment. The report was it's worked great, and then leadership said, "Nah, we don't believe it. We're not going to do it. That's not how we did it back in my grandpa's day." I shouldn't be so mean, but that's part of it. But part of it is technological. If somebody's going to work at home, they need the tools. They need access to data securely with privacy protections and confidentiality requirements, and a lot of agencies have been slow to meeting that need. So that's one piece. And then another piece is workforce roles. So we have, rules in place that have been around for decades that responded to serious problems with corruption and nepotence and incompetence, and that have said that when it comes time to making the key decisions on which people's lives literally can depend, public employees hired through merit processes or merit-based hiring have to be the ones who make the final decisions. That's been the common understanding in a lot of benefit programs. And there are huge advantages to that, but it obviously imposes some constraints. And so I will just mention one example of the net effect of all of these constraints and the operation of the Medicaid program that was horrifying, I think. That the CMS, the Centers for Medicare and Medicaid Services, the federal agency that runs the Medicaid program, sent a notice to states early on in the pandemic saying, hi, we know a lot of your workers are working from home, and we know that reduces their efficiency, and we know that makes it harder for you to meet minimum timeliness requirements for quickly processing applications. So what did they say? Did they say, so here are ways you can cut the workload required, here's the ways you can increase your staff or give new responsibilities to, people, to temporary employees or to contractors? No, none of that. They said, oh, just you can delay processing applications. These timeliness standards, you can ignore them. So think about that. That means that a poor, uninsured person with a deadly, highly infectious pandemic sweeping through their community must sit and wait as long as it takes to get their application for health insurance approved. That is a scandal, and that's something that Congress needs to address. Next slide, please. Now, when we look forward, we do not see happy times ahead. As you all know, COVID cases nationally have been spiking upwards. It varies by state. In some it's going up fast, in some it's going up slow, and some it's actually kind of going down. But overall, we're seeing new COVID cases. Next slide, please. And that means there's danger ahead for public benefit programs in two big ways. One, as COVID cases get worse, public benefit applications tend to rise. Almost every economist that you encounter on the web or otherwise will tell you the most important thing we can do to get the economy going is to beat the COVID-19 virus. And there's a University of Chicago study that says that's not mainly about stay-at-work orders, rules from the government. It's mainly about people being scared to leave their house and go shopping. As long as we have the pandemic raging on the streets, the economy is going to not improve and potentially get worse, and that means more applications coming down the pike for these need-based programs. So the crush we've seen earlier may not abate because the economy may not get a lot better. There's a second issue, a second danger ahead, which we've seen in previous economic downturns, and we'll surely see it in spades this time unless Congress provides states with significant fiscal relief. And that is that at the very moment when more people are turning to these programs for need-based assistance, state agencies are strapped for resources, unable to get resources. Why? States have to balance their budgets. It's a constitutional requirement in all states but Vermont. And that means if you're in a recession and your revenues have plunged through the basement and your caseloads have risen through the roof, you have to balance your budget. That means you have to cut benefits, you have to raise taxes, none of which anybody likes to do, or you can cut administrative staff. And that is a very appealing option for politicians who are not looking at the consequences of what they do. So what we've seen in recessions in the past, and what is likely to happen now unless Congress provides states with lots of fiscal relief, is that at precisely the time when benefit programs need the most capacity, they are stripped of capacity. Furloughs happen, layoffs happen, hiring freezes happen, and the command comes down from on high, well, now you must do more with less. Well, that is not an easy challenge. In a few moments, we'll talk about ways that Congress in the next COVID-19 package can help states meet that challenge, but now I'm going to turn over for the next section of our conversation, please move to the next slide, to the amazing Michelle Evermore, who will tell you all about unemployment insurance and how its tales of woe illustrate some of the problems we've been discussing.
Hi, thank you for that. I'm so glad to talk to you today, and I know that if you work on unemployment insurance right now, this is a really tough few weeks for you, so I'm really glad that you've joined us. So advance to the next slide. I can start talking about where we're at. When I talk about UIIT, I say that we're at best dealing with a neglected system, but at worst a sabotage one. So let's talk first a little bit about the neglect. So first of all, unemployment insurance for the uninitiated is a patchwork of state systems. And so there are few federal parameters about who gets benefits, how much they get, how long they get them, how much income is replaced. And so, that means that every state system is also going to be different. And there are 53 state systems for every state, the District of Columbia, Virgin Islands, and Puerto Rico. So, 53 different state systems all administering a quite strikingly different program in every state. So appropriations for administration of unemployment insurance is in the labor age approps. And it's been not just stagnant, but has declined since 2001. In 2020, that line item was $2.14 billion. In 2001, that was $2.21 billion. And a lot of that is because we count on, these emergency appropriations to show up when recessions do. And in a normal recession, that kind of works because the onset is generally a little bit, it's a much slower rise than we've seen lately. But as we all know, this recession just hit like a truck, right? By way of comparison, historically, the highest number of new claims in a week was 695,000 in October of 1982. But the third week in March, we saw 3.3 million new claims, followed by 6.6 million for 2 weeks in a row, 5 million, then 4 million. 19 weeks in, we're still seeing 2 million new claims every single week. And, that's and I'm sorry for the typo on the slide. It's 695,000 in October of 1982. I don't know what I did there. Sorry about that. And so, this is a historic new load for these state systems, on top of which they've had to stand up this new pandemic unemployment assistance program, the new SPOC, the extra $600. There's this international fraud ring that is systemically attacking systems. So, there are people who are still waiting for their benefit from March. And so when it comes to IT, it's especially neglected. It's a very expensive thing to undertake with that little money. State staff are operating on a shoestring. Now, during the last recession, there was a UI Modernization Act where money would go to states to do benefit improvements. They had to add an alternative base period to calculate benefits and then include some other improvements. IT was one of those things that they could use the money for. One of the problems with that is they had to do it in a consortium to get the funding with other states. And this makes some sense because, right, states that come together in a consortium can bargain for a better deal and solve problems across state lines. So if a problem crops up in Massachusetts and they're working with somebody in New Mexico, they can say, they can go to the other state and say, did you have this problem as well? How did you fix it? So, on some level that makes sense, but what ended up happening in reality is that these consortiums would crumble as political leadership would change in states or visions about how to do the project would change in states. And so states would spend money to start a consortium, but then some of them fell apart. And so those allocations ended up, just washing away. Next slide. So, this is a picture of which states are modernized. As you can see, the golden states are fully modernized. What does modernize really mean in this sense? Just that they've upgraded from the 1970s COBOL mainframe and with it have brought along some business practices to try and smooth that implementation. What it doesn't mean is that the system is accessible or in any way usable, which I'll talk about in the next slide. And what we've seen in several states is the initial modernization effort almost always came out with poor results. There was almost always a bumpy rollout that resulted in more denials, more people waiting in line, and huge backlogs in terms of call center delays. So states have had to roll out much more massive call centers to take all the new questions, and so many states that we've seen modernize have now remodernized and are in the process of modernization again. Massachusetts again comes to mind. Washington, Maine. You know, a lot of the states that have done something have realized they have to do, you know, more and more changes as time goes on. And the guidance that they get for this is relatively minimal. There's a checklist of, you know, it's basically a to-do checklist that the Employment and Training Administration shares with them. And as you can see, this slide comes from the National Association of State Workforce Agencies Information Technology Support Center. The ITSC is a sort of collaboration with the Department of Labor's Employment and Training Administration, and they do offer states some kind of technical assistance and best practices, but it's not the kind of coordinated, real nuts and bolts IT advice that states have expressed a desire for. Next slide. So, you know, when I said it at best neglected, there are some systems that were actually modernized with the plan to fail. And so, you know, I just want to compare two side-by-side systems. Florida's Connect system was launched in the fall of 2013. Both of these systems were implemented on the heels of legislation that was designed to limit access to benefits, and immediately thereafter the computer system was implemented. So people found that they were having to wait 2 to 4 months to get an initial claim through. My organization, along with some organizations in Florida, filed a complaint with the Civil Rights Division at the Department of Labor. The Department of Labor found that the system to be discriminatory. There was no access for people with limited English proficiency or disabilities, and even the backup systems were not geared to help people with these with limited English proficiency. For example, the call center workers were trained that when somebody called who didn't speak English, they should just speak more slowly. So 2 failed audits have happened, never been resolved. And so as you probably have seen from the headlines, Florida was one of the bumpiest states in terms of getting these benefits up and running. The system crashed horribly at the start of the pandemic, and people were actually standing in line for paper applications in March. A lot of that has been resolved. A lot more people have gotten through the system. They're limping along, but it has not been an easy process, and you know, still 10% of applicants have not been approved or not even been processed. Michigan's MIDAS system, along the same lines, in 2011, Michigan reduced benefit duration and implemented a lot of new fraud investigations, and actually increased the penalty for fraud to 4 times the amount paid plus 12% interest. And so unsurprisingly, the algorithm programmed into this system was flagging a lot of people for fraud, more than 40,000. I think that the class that's suing the state might be up to 60,000 now. It was found to be 93% inaccurate. So, you know, there's an ongoing lawsuit in this. People lost their homes and in some cases even lost their lives because of this false flag. The good news is the UI director in Michigan comes out of the claimant advocacy community, and so has been looking at the computer system and trying to figure out where there are off conditions that should be turned on, what it is that's slowing approvals, what are the conditions through which people get flagged for fraud. You know, some of these are like, if more than one person logs in from the same IP address, they get flagged for fraud? Well, that's anybody who doesn't have a computer at home and had to go to the public library, right? Or people who are claiming from the same address. Well, those are people in homeless shelters, So trying to figure out who gets flagged for fraud and turn those conditions off was really useful. And so at the end of the day, when it came to this recession, Michigan was one of the fastest states among large states in terms of processing. And, this is also a question of will, right? So Florida's Connect system was actually modernized in a consortium with Massachusetts and New Mexico. Florida never remodernized, never worked on the system, never tried to make it more accessible. And so as a result, had experienced much more difficulty with this recession than either Massachusetts or New Mexico, operating on largely the same system. Next slide. So some basic things that we can be thinking about going forward in terms of making sure these systems actually work for people. Fully fund, and I think that there's a lot of political will to do that. There was funding included in the leadership package that came out this week. I think that there's, I have strong hopes that funding will arrive. So the other issue is that the Department of Labor doesn't really have anybody who can oversee these systems, make sure there's nobody to bounce questions off of at DOL when it comes to what practically do we need to be thinking about in terms of, what are some real nuts and bolts best practices and in terms of creating on conditions, off conditions, where do we flag, where do we not flag, how do we even set up ways to find out where people are getting caught up and figure out how to solve their problems? We've recommended a federal commission on modernization of federally funded benefit programs. We also believe that as user experience is important. And I think that states, when they're standing up these new programs, they're really thinking about back-end stuff. They're thinking about how to make this easier for the agency. And it's clear when you look at any of these online applications that none of them have been user tested prior to launch. And so just having people who are going to use this system provide input would be extremely helpful, particularly those that are underrepresented. People in the Black community, with Latinx community, Indigenous community, other communities of color, people with disabilities, people with limited English proficiency, low-income folks, and workers on the other side of the digital divide. A lot of these systems aren't mobile responsive either, and so thinking about things like that is really important. And then just simple stuff like 24/7 access. A lot of these are 9 to 5 systems. There's no reason for that. Password resets often have to, you have to call and talk to a person on the phone, and these lines are all jammed up. And then you'll get a password through the U.S. Postal Service days later. Little things like user experience audits, asking people what their experience was and what was hard for them, finding out where the pain points are. Little things like being able to go back a page. That's not possible in a lot of these systems. Being notified that you're about to time out. Being able to check back on your benefits. Having callback systems. Not all states have that, so people have to just reach a live person. So anyway, there are a lot of easy things that could be implemented quickly. And we stand to work with Congress to figure out how to, as funding is considered, how to make that funding actually go to a system that people can use. And I will turn it back over to Stan.
Wow, thank you, Michelle. Fantastic information. I'm going to pick up the baton that Michelle just tossed me to talk about what Congress can do in the next COVID-19 legislation. And obviously not everything desirable in the world can or should fit into that legislation, but we are looking at a serious crisis, and there are important things Congress can do. Next slide, please. I'm going to again turn to my favorite state Medicaid program, Louisiana, for an example where of how Congress, or in this case it was the state along with federal policy, how if you give the state agency the ability to modernize and to use 21st century information technology and the insights of behavioral science, you can actually overcome some pretty serious administrative limitations that inevitably fall upon these agencies during recession. So during the Great Recession, huge staff cuts across the board in Louisiana programs, and the Medicaid program was able to manage. They were able to process applications. They were able to keep eligibility quality up. They had some of the lowest error rates in the country. They were able to keep enrollment at high levels, and a big part of that was that they were moving in the direction of modernizing their program already, and they continued down that road. So the Expresslane Eligibility piece was one that I mentioned earlier, where manual determinations were not necessary, manual processing, shuffling of paper, analysis. If somebody got SNAP, they were qualified for Medicaid. There were efforts to make sure you did renewals. If you could find an external data source that verified somebody remained eligible, you could just renew them automatically without contacting them and asking them for information and wasting your time and risking a procedural termination of an eligible person. They mined their case records to see the kinds of people who remain eligible over time to a reasonable certainty, and they renewed their eligibility automatically. All of these things enabled them to do well in a very challenging environment. So the question is, what can we learn from this in terms of equipping states right now, equipping a range of benefit programs with the tools they need to manage the enormous tasks that lie before them? Next slide, please. So coping skills. We're all struggling, and so imagine your happy place. That works for some kinds of coping, but it is not going to be sufficient for public benefit programs. Coping with a flood of applications and demands from state legislators that they, quote, cut the fat, unquote, which means starve themselves for administrative resources they need to run their programs properly. So one piece is for Congress in the COVID-19 package to provide administrative funding to help these programs cope. IT modernization, as Michelle was talking about for UI, could cover other benefits as well. Increase staff if there's more demand, we could have more staff. But business process modernization. Modernizing IT by itself is, that's like, walking down the road with one foot and not the other foot. Getting more information doesn't help you if you don't know how to use it, if you don't revise how you do business so that you can incorporate that information well. And that is not an easy thing. States need help. They may need expert outside advice. They may need time to figure out what to do, and so Congress needs to provide money for business process, strategy, and improvement, as well as tech and staff. That's the first thing. Second is to modify eligibility rules and procedures, enabling more efficient operations. I'll give you one example. From my perspective as a longtime Medicaid advocate, I look at the SNAP program in horror. Things like out of the 1950s are still being mandated. You have to come in for an in-person interview. It doesn't matter if your paperwork is in order, if your eligibility is clear, you have to come in and let the caseworker look you in the eye. Thankfully, the Congress in previous legislation removed these barriers, allowed states to get waivers to do things like, not have in-person interviews and make it possible for people to complete paperwork electronically instead of on paper and in person. And shockingly, federal officials running the program have been telling state officials, well, this can't happen forever. Paradise can't last forever. We're going to have to get back to regular business soon. So you're going to have all kinds of people coming into the office and talking to your 55-year-old caseworkers in person, across the desk, and, well, good luck. Hope not too many of you die. Hope you can manage okay. I mean, that is just ridiculous. And so thankfully, Marcia Fudge in the House has put forward legislation that would mandate the continuation of these waivered flexibilities. I think that's really important for the SNAP program to cope with the wave that is continuing to hit. SNAP has done an amazing job handling the load that has fallen on its shoulders, and that will not be possible without these kinds of flexibilities. The second example, let the Medicaid program automatically provide eligibility to people who get unemployment insurance. Provide 100% federal funding. If somebody has UI and they say that they're uninsured, if the UI office doesn't grant you benefits unless they find that you are unemployed for no fault of your own, you are looking for work, you can't find it. Those folks who are uninsured, why on earth would we not provide them with Medicaid? So all of that is modifying the eligibility rules and procedures to enable more efficient operation. I mean, by the way, you give somebody Medicaid based on UI, you don't have to process a million pieces of paper. It's both good for the consumer and it's good for the taxpayer. So that's one thing. A third piece that Congress should put into this package, if they can, is to improve access to data. So, the more programs can use data to qualify people for benefits, the more efficiently they can operate and the easier it is for the consumer. So, for example, there's a federal data services hub that operates in the Medicaid program, provides one-stop access to a lot of useful information. SNAP and other benefit programs can't get access to that full scope of data, in part because of the initial data use agreements. Congress could mandate that the federal government move forward and make that hub available for all programs to use. Another example would be the National Directory of New Hires that has information about quarterly wages from every state, from federal employees. If you're a state, you may have your own quarterly wage database, but the NDNH, the national one, lets you know about people who are working across state lines, lets you know about federal workers, and then it actually gets you quickly. California, you can get access to NDNH data from California employers a quarter before you can get it, a calendar quarter before you can get it from California. It's the data that comes from the California database. It goes to Uncle Sam. If you are a benefit program, you can access it quicker from Uncle Sam than from your own doggone labor agency. Medicaid programs, CHIP programs, the exchange do not have access to NDNH. Other benefit programs do. Why on earth we don't provide access, I will never know. Now's the time to do it. Next slide, please. Changing the disincentives so that states don't have a financial penalty if they do the right thing by providing benefits to consumers. So that would say that that sum on the scale I talked about earlier should be equalized, so that an incorrect finding, an incorrect determination, whether it grants the wrong benefits or it denies benefits to eligible people, has the same consequence. That would be very helpful. Making sure that consumers are not penalized if there's a state or federal policy decision, a change in practice that results in temporary unwarranted increases in aid. We should not be taking it from out of family budgets. People are having trouble putting food on the table. They should not be punished for what happens in federal or state policy. And then finally, if a state reasonably implements expedited procedures, it should not be penalized. It should not be sanctioned. It should not be deemed as having made mistakes. If we want states to go forward and serve people in need, we have to make sure that they're not worried about being hit by a federal hammer or terrible headlines down the road. Next, it's really important to let state programs leverage some amazing work that's taking place at the General Services Administration, Technology Transformation Services, and the U.S. Digital Service of the Executive Office of the President. So these folks, for the federal government, they're building application programming interfaces that can automatically incorporate new federal eligibility rules so that a state could connect itself to that system and it wouldn't have to do expensive, risky, time-consuming procurement. It would just automatically be tied into these new rules and you'd get a determination of whether a particular individual is eligible or not. The GSA, the Technology Transformation Services identity proofing functions so that, with health coverage, for example, where people have often been unable to get to step one because they don't have a credit history, that would not be a barrier with these new modern systems being developed federally. Form development, cloud-based records, all these functionalities would enable states to be so much more efficient in providing good consumer service, but often they can't be provided to the states because of legal barriers, legal questions. Congress can end that. They can just say, do it, provide the access if the state wants it, and provide some funding as well to help pay for it. And finally, workforce modernization, supporting remote work, and then the other question is surge capacity. It's not just during an economic crash that a surge happens. It can happen with natural disaster. Katrina, Hurricane Sandy are good examples, or sort of a human-made disaster where Medicaid programs, for example, sometimes haven't been able to do renewals for many months because of IT problems. Then suddenly they have to process 12, quadrillion cases in the space of a week or two. That is a crunch. And so can we develop surge capacity? There have been some things, the CARES legislation gave UI programs new flexibility to take functions that had been previously reserved for merit-based employees and use contractors or temporary employees. How is that working? I don't think anybody knows. Are there other strategies we can do to develop surge capacity more focused on on using existing state employees or bringing back retirees or other ways of operating. One thing that I would think about doing if I were in Congress is to commission a study by the National Academy of Social Insurance to examine the question of, do we need more surge capacity to deal with these sudden spikes? And if so, what's been the experience thus far, and what would be a good thing for Congress to do going forward? And that's plenty to add to the plate. And here we are at 1 hour's time.
Thanks so much, Dan, and thank you, Michelle. This is Lisa Hunter again. I think we have time for one question if folks have it. We have a couple in the chat box, but I want to give folks a quick moment if they haven't entered anything in. And then what we will do following this is also send out to registrants a copy of the slides as well as a link to the recording that we'll be posting on our website in the next couple of days. So I think I'm just going to do a very open-ended question, or rather broad question, to pose to both Stan and Michelle. Congress has a lot on its plate right now. The job of pulling together the next COVID-19 package is already hard enough. Why should Congress take on the proposals you are suggesting, and won't they just bog things down with the next legislative package? So,
Michelle, do you want to go first?
Yeah, well, I think that question is pretty easy on the unemployment system. As we know, the $600 expired at the beginning of this week. It is already gone. It is already programmed out of the computer systems. And so we know that whenever Congress acts, it's going to take at least 2 weeks to spin these programs back up again. I think now is just a pretty obvious time as people are suffering, as people are waiting for their unemployment insurance benefits to include some sort of modernization funding.
And I totally agree with all of that. To me, there are two reasons why Congress needs to prioritize this right now. One is that the economy is really bad right now, and it's not going to, happy days will not be here again for a while. That's what all economists are telling us, pretty much all economists. And so that means people are going to need these programs for meeting their basic human requirements, including survival. And if these programs don't get the tools they need to function effectively, constituents for every single senator and member of the House will be suffering and will be calling and making their complaints known. That's number one. People need these programs. Number two, we are sailing into a very tough time for these benefit programs because of those state budget cuts I was talking about and the need to balance the budget. So precisely when the tsunami of application and the wave of need is hitting, state public benefit programs are going to be starved for resources as never before in meeting that need. And so one piece is to provide them with resources, but another piece is to provide them with new tools that they can use to manage more efficiently, accessing those federal eligibility services, giving them access to more data, making the eligibility rules simpler and more streamlined and more tied into available data, by making the job of state workforce agencies, of state public benefit agencies easier, more efficient, more streamlined, and providing them with additional resources. That's the only way we're going to avoid having people all around this country experiencing a wall of woe. And here's the other thing. Congress is going to be doing great work, no doubt, improving people's benefits, saying if you're in situation X, you get Y. But if the infrastructure behind these programs is not able to deliver those benefits, Congress's hard work is going to go to waste. Human beings won't get those benefits. If you want to make sure that the legislation you pass accomplishes its goals, you better make sure you spend time and effort beefing up the fundamental infrastructure of these public benefit programs.
Thank you so much, Stan. That takes us to the end of the briefing. Again, we'll make this deck and recording available on Families USA's website. And any questions or feedback, please don't hesitate to reach out. Many thanks again, and I hope everyone has a safe and restful weekend. Take care. Bye-bye.